Before we begin, we'd like you to know that there are more training opportunities available through the Nonprofit Alliance of Bermuda. Look for this sign during the presentation for more of these opportunities. So you must be thinking, what is the need for a training on beneficiary brokering service models? And what does that mean anyway? Well, most of us in nonprofits, if we've been around for a while, not always experience receiving donations in cash or monetary form. There will be donors and sponsors, corporate, church groups, families that will provide donations in the form of gift cards and vouchers and other non-monetary items. But these items have a value, and sometimes we don't even appreciate how much of a value that they have. For example, the year that I discovered as an executive director that the room full of donations in the form of groceries that we have received equated to $11,000. The first thing that our treasurer said to us was that we had to count every item that was donated and give it a monetary value. When we did that, the auditors recognized it as a substantive donation in our audited report. Brokering services is a very important task in the community. It means that we as organizations have been selected because we are trusted to not only fairly and equitably distribute whatever has been given to us, but also to responsibly account for it. Many times we can be fooled into thinking that this is easy, but a brokered service requires the same amount of time, attention, and qualified personnel as other services within our organization, even when that brokerage service is simply a complement to an existing program. In the following presentation, we will go through the complexity of offering a brokerage service according to the Bermuda National Standards Committee guidelines. Hope the information is helpful, and we hope that you are encouraged to structure your program in such a way that your beneficiaries feel the greatest impact and the community understands and trusts that you are able to do the job. Since you have signed up for this course, we can already assume that you've asked the question, why the need for brokerage services? There are many local examples of brokerage services. There's me at Age Concern Bermuda advocating for seniors and food security. Bermuda nonprofit leaders often act as advocates for the populations they serve. In response to client needs, some donors choose to give gifts in kind, certificates, gift cards, or vouchers to meet a need. When this occurs, the nonprofit organization serves as a broker between the donating entity and the client, ensuring accountable and transparent distribution systems exist within their nonprofit organization that results in responsible distribution of donated goods and services. So what are beneficiary brokerage services? We will refer to these from time to time as BBS. Beneficiary brokering performed by private, nonprofit, and government entities can provide an efficient and cost-effective mechanism for service recipients that improve access to much-needed resources through cash or representative payment, whether by voucher, gift card, cash, cryptocurrency, or other forms of financial assistance. Beneficiary brokering requires systematic oversight and service recipient engagement to ensure stable, sustainable community impact. Let me provide you with more detail. Vouchers or coupons include any form, bond, or documentation that entitles the holder to a prescribed benefit, such as a discount, goods, or services, and is considered an in-kind donation when compared to a cash allowance granted for the same purpose. Gift cards carry a monetary value for redemption at specified participating providers and may be considered a type of voucher for brokering purposes. Either option may be deployed with parameters for the holder, such as who may access the benefit, expiration dates, limitations, etc. Cash allowances and/or cryptocurrencies, alternatively, do not carry inherent limitations for redemption for the identity of the holder and are considered as cash donations when received. Here are some examples that may provide vouchers, cash, or cryptocurrency allowances for service recipients to redeem. Transportation assistance, such as public transportation passes or taxi vouchers. Education or skill development, such as tutoring services or private school attendance. Food banks, pantries, and other food provision services. Clothing assistance to obtain clothing from partnering organizations. Healthcare services for prescription medication, medication consultation or treatment, housing and shelter services. As within all nonprofit practices, there are standards for beneficiary brokerage service models. This model promotes program evaluation to the greatest extent possible given the challenging circumstances under which disaster recovery and crisis managed services are often delivered. Recognizing it may be difficult to track client outcomes given the nature and duration of disaster recovery and crisis management services. If client outcomes are not being tracked, the organization must be prepared to demonstrate how program level outputs are being used to build capacity, improve programs, and have a positive impact on the persons being served. Additionally, the organization may speak to how it uses community-wide outcomes, data collected by outside entities, to make data-informed decisions within its program when appropriate. When building a BBSM, know your logic model. Before determining that your nonprofit should engage in a brokerage service, consider this key question. Does the intended brokerage service align with your organization's overall mission, goals, activities, outputs, and outcomes? Here's a step-by-step guide on how nonprofits can do this effectively. Ensuring your brokerage service model is aligned with your mission. Understand your organization's mission and goals. Before integrating the brokerage service into the logic model, you should have a clear understanding of your mission and overarching goals. This provides a foundation for determining how in-kind services fit into your organizational objectives. Identify key activities supported by your brokerage service. Determine which activities of your organization are supported or enhanced by the provision of brokerage services. These include things like educational programs, health services, community outreach, and so on. Specify outputs linked to your brokerage service. Define the tangible outputs that result from the provision of brokerage services. Outputs might include the number of individuals served, the quantity or value of goods distributed, or the reach of services provided. Establish short-term and intermediate outcomes. Determine the short-term and intermediate outcomes that are influenced by the provision of your brokerage service. These outcomes should reflect the changes or benefits experienced by the target population because of receiving the in-kind support. For example, improved health outcomes, increased knowledge, enhanced community engagement, and so on. In addition, integrate your brokerage service into your organization's current logic model. Incorporate the provision of the brokerage service into the appropriate sections of the logic model. This includes linking brokerage service resources to specific activities, outputs, and outcomes within the model. Visual representations such as diagrams or charts can be helpful in illustrating these connections. Define your indicators and measurement methods. Identify indicators and measurement methods to track the delivery and impact of your brokerage service on the organization's activities and outcomes. This could involve tracking the quantity or value of in-kind donations received, monitoring the distribution of goods or services, conducting surveys or assessments to gauge the effectiveness of your brokerage service support. Monitor and evaluate impact. Regularly monitor and evaluate the impact of your brokerage service on the organization's logic model. This involves collecting data on the delivery and effectiveness of in-kind support, assessing progress toward desired outcomes, and making adjustments as needed to optimize the use of brokerage services resources. And finally, communicate your results. Share the results of monitoring and evaluation, efforts related to in-kind services with your stakeholders, including donors, other funders, program beneficiaries, and the broader community. Highlighting the impact of brokerage services helps demonstrate the value of these contributions and can support ongoing resource mobilization efforts. Like any service that a nonprofit provides, there are risks associated in providing brokerage services. Leaders must be mindful to safeguard your nonprofit's financial integrity. Safeguarding your nonprofit's financial integrity is essential for maintaining trust, compliance, effective resource management, fraud prevention, donor confidence, and strategic decision making. By prioritizing financial integrity, nonprofits can ensure their long-term viability, impact, and ability to fulfill their mission in the communities they serve. So, what exactly does it mean to be responsible in terms of your financial stewardship with your beneficiary brokerage service management model? You never want to be in a situation, as I have had, where there has been a compromise in your service. That can happen even when you're not operating with cash. There are many factors that are involved in ensuring that you have a safe environment in which to conduct responsible financial stewardship. Let's look at a few of the conditions that are necessary for this environment. Maintaining trust and credibility. Nonprofits rely on the trust and the confidence of their donors, funders, beneficiaries, and the public to fulfill their mission effectively. Safeguarding financial integrity demonstrates transparency, accountability, and responsible stewardship of resources, which are essential for maintaining trust and credibility with stakeholders. Compliance with legal and regulatory requirements. Nonprofits are subject to various legal and regulatory requirements related to financial management, reporting, and governance. Failure to uphold financial integrity can result in legal penalties, loss of charitable or tax exempt status, or damage to the organization's reputation. Adhering to these requirements helps ensure compliance and protects the organization from legal and regulatory risks. Effective resource management. Nonprofit organizations rely on financial resources to deliver programs and services, to support operations, and to pursue our missions. Safeguarding financial integrity involves establishing internal controls, budgeting practices, and financial oversight mechanisms to ensure that resources are used efficiently, effectively, and in alignment with the organization's priorities and goals. Just because a donation is in kind doesn't mean that we don't have a responsibility of financial stewardship. The beneficiary brokering service model reminds us that even in-kind services should be treated as seriously as we do cash. Responsible financial stewardship also involves preventing fraud and mismanagement. Financial mismanagement, fraud, and embezzlement can have devastating consequences for nonprofit organizations, leading to financial losses, reputational damage, and disruption of operations. Safeguarding financial integrity involves implementing internal controls, segregation of duties, and oversight mechanisms to prevent and detect fraudulent activities and ensure the proper use of funds. Enhancing donor confidence. Donors and funders want assurance that their contributions are making a meaningful impact and being used responsibly. Nonprofits that prioritize financial integrity demonstrate their commitment to accountability and effectiveness, which can enhance donor confidence and support. This, in turn, can lead to increased funding opportunities and sustainability for the organization. Facilitating strategic decision making. Accurate and reliable financial information is essential for informed decision making at all levels of the organization. Safeguarding financial integrity involves maintaining accurate accounting records, conducting timely financial reporting, and providing relevant financial information to stakeholders. This enables nonprofit leaders to make a strategic decision that supports the organization's missions and long-term sustainability. So let's talk about accounting rules and controls. The accounting infrastructure within a broker services model should include accounting policies and procedures that explicitly speak to roles, responsibilities, and levels of financial accountability among clinical, accounting, and related personnel, accounting systems, financial controls, and segregation of accounting duties. This is not an exhaustive list. Learn about internal control procedures. Click on the YouTube icon to listen to the video. The benefits of safeguards of financial policies and controls are financial integrity, prevention of theft and fraud, and financial reporting accuracy. Here are some elements of administering a quality brokering service program. Program design, program indicators and outcomes, appropriate and qualified program staff, continuous staff training, an intake and assessment process, service planning and monitoring. Now let's look at each of these components individually, starting with creating a program design for your beneficiary brokering service model. What is nonprofit program design? Nonprofit program design is the process of conceptualizing, planning, and creating initiatives or projects that address specific needs or issues within the community or target population served by your nonprofit. It involves a structured approach to developing programs that align with the organization's mission, goals, and strategic objectives while also meeting the needs of the intended beneficiaries. We will not go into great detail into nonprofit program design during this training presentation. However, you should note that the Nonprofit Alliance of Bermuda offers specialized training on nonprofit program design. Please see us if you require more information. Brokerage Service Model Indicator and Outcomes. When undertaking a brokerage service model, your nonprofit's logic model can identify client outcomes in the following areas: change in clinical status, change in functional status, health, welfare and safety, permanency of life situation, quality of life, achievement of individual service goals, and other outcomes as appropriate to the program or service population relating to voucher and financial support. Be sure to choose at least two indicators when measuring brokerage service outcomes. When staffing up to administer your brokering service model, ensuring qualified individuals undertake clients' assessments is essential for ensuring accuracy, reliability, and ethical conduct of assessments, as well as maximizing the organization's impact. As a standard for brokering service management personnel, at the very minimum, personnel should have a bachelor's degree in a human service field, case management or other equivalent certification, or a bachelor's degree in a field other than a human service with appropriate experience. A very important part of your brokering service model will be the requirement of qualified oversight personnel. When administering your program, nonprofits must ensure that supervisors are qualified by an advanced degree in social work or comparable human service field, and a minimum of 2 years experience in direct services or case management, a bachelor's degree in the human service field, and 4 years experience in direct service or case management, and or licensure or certification in case management or other equivalent certification, and 4 years experience in direct services or case management. Nonprofits operating at a high standard of excellence will ensure that personnel require continuous training. Programming administrators of the beneficiary brokerage program or the direct service delivery personnel must receive training on or demonstrate competency in the following topics: coordinating services as a part of a team, assessment and distribution of beneficiary brokerage services, linking service recipients and making referrals to community services, and knowledge of public assistance programs, eligibility requirements, and benefits. With respect to the beneficiary brokerage service model intake and assessment, and responsive intake practices include screening for level or intensity of service, gathering information necessary to identify critical service needs and or determine when a more intensive service is necessary, giving priority to urgent needs and emergency situations, evaluating financial needs against beneficiary brokerage options, supporting timely initiation of services, and providing for placement on a waiting list or referral to appropriate resources when individuals and families cannot be served or cannot be served promptly. When determining if, when, where, and by whom services are provided, consider the following screening questions: how well the request matches the organization's services, and what services will be available and when. Intake, competencies, and caseloads. Caseload sizes are sufficiently small to permit programming administrators of the beneficiary brokerage program to respond flexibly to differing service needs of individuals and families, including frequency of contact, and to support the achievement of client outcomes. Factors that may be considered when determining employee workloads include, but are not limited to, the qualifications, competencies, and experience of the worker, including the level of supervision needed, the work and time required to accomplish assigned tasks and job responsibilities, and service volume, accounting for assessed level of needs of persons served. Here's how you can help your organization Adapt a client-centered approach. When using a beneficiary brokerage service model, individuals and families should be provided with opportunities to participate in individualized, culturally, and linguistically responsive assessments. These include completed and are completed within established timeframes. They have clearly and transparently disclosed the parameters of the beneficiary brokerage program. Assessments are updated as needed based on the needs of the person served and focus on information pertinent for meeting the service requests and objectives. Please note, an assessment matrix that can be tailored for benefit brokerage service programs may be used to support evidence demonstration and is available from the Bermuda National Standard Committee. When conducting an assessment in person or in an environment of the client's choice, include an assessment of natural supports and helping networks, and promptly provide or make arrangements for specialized assessments as needed prior to delivery of the beneficiary brokerage program. There may be times when there are sudden or unexpected events that take place in a client's life that require reassessment. This can often be referred to as event-based reassessment. Individuals and families should participate in a formal reassessment annually or more frequently on an event based using the following criteria to verify the extent to which the brokering service programs are required. Within 5 working days of a precipitating event, when there is a change in their status or circumstances or a new issue arises, and within 48 hours of notification that a hospital or institutional discharge is imminent. An organization that, due to contractual requirements, is unable to conduct event-based reassessments according to these 3 timeframes should modify them to meet the needs and goals of the persons being served. Service planning and monitoring of needs assessment data. When implementing a brokering service model, an assessment-based service plan should be developed in a timely manner with the full participation of persons served and their family when appropriate. Steps to achieve full participation include agreed upon goals and desired outcomes and timeframes for achieving them, services and supports to be provided and by whom, details of the beneficiary brokerage program benefits and requirements, possibilities for maintaining and strengthening family relationships and other informal social networks, procedures for expedient service planning when crisis or urgent needs are identified, and should include the individual's signature. Again, a person-centered approach to your program should include individuals and families in the assessment planning process. This is demonstrated by having sensitivity to your client's needs and personal goals, engaging them in a non-threatening manner, having respect for their autonomy, confidentiality, social cultural values, lifestyle choices, and complex family interactions, flexibility, and appropriate boundaries. You should also ensure your organization maintains a comprehensive, up-to-date list of community programs and services and information on how to access them. When working in active partnership with individuals and families in service planning and monitoring, remember to directly provide or arrange for necessary services, provide case coordination and monitoring of services, ensure that your clients receive appropriate advocacy support, assist with access to the full array of services to which they are eligible, and mediate barriers to services within the service delivery system as a whole. So here's an example of what a service and monitoring plan should include. Confirmation of beneficiary brokerage eligibility, information usually within 1 or 2 days that a service has been initiated as scheduled, verification usually within 15 working days that the service is appropriate and satisfactory, follow up every 3 months, and immediate response to any complaints or problems that develop in the delivery of services or with the individual or family receiving those services. Remember, your organization should tailor the type and frequency of service monitoring according to the needs of the individuals and families you are serving, and the frequency and intensity of the service provided. This also includes the frequency of contact with informal caregivers and all others cooperating with the service delivery process. In addition, in ensuring that your beneficiary broken service model is operating at best practice, staff reviews will be required. The worker and the supervisor or a clinical service or peer team should review the case or cases quarterly or more frequently, depending on the needs of individuals and families, to assess the following: the service plan implementation, the individual's or family's progress toward achieving goals and desired outcomes, and the continuing appropriateness of agreed upon service goals, including repeated access to beneficiary brokerage programming considerations. Remember, when experienced workers are conducting reviews of their own cases, the worker's supervisor must review a sample of the worker's evaluation as per the requirements of the standard. The final step of your service planning will include co-signing service planning and monitoring outcomes and agreements. Co-signing involves the workers and the persons being served, which may at times be family members where appropriate. As a part of co-signing, there must be a review of progress toward the achievement of the agreed upon goals of service. Finally, the agreement must be signed off in addition to any revisions to the service goals and plans by those being served and the caseworker. We have reached the end of a very brief introductory to beneficiary brokerage service models. We hope that you have acquired some tools to start your program or enhance an existing program. Should you require more information, contact us at the Nonprofit Alliance of Bermuda. We are here to support your training needs. Ready, set, grow. Remember, an empowered beneficiary is the best mission strategy of all.